Hello listeners, welcome to Views on Health. And as yet another Monday evening comes by, it's a great pleasure to have with me on the program tonight Dr. Sivayoganathan Premananda, who is a consultant eye surgeon at the University Hospital of the Kotalavala Defense University. Welcome, Doctor, to SLBC and our program.
Thank you. Pleasure to be here.
Yes. And as a consultant eye surgeon, the focus on the program tonight is on glaucoma. Over to you, Doctor, to introduce the topic.
Yeah, of course. So, thank you so much for the opportunity. This topic is very important. Actually, glaucoma means that actually affects the nerve behind the eye. We call it optic nerve. You can imagine like this. Actually, the nerve is actually connecting the eye to the brain. So that is like a wire through which all the information from the eye goes to the brain. So if there's a problem in that nerve, then whatever the information comes into the eye, if an image falls into the eye, and that information is not going to conveyed to the brain. So there may be a problem, the vision may go down, the patient might get blurriness, and most importantly, glaucoma due to various reasons, but most of the time the patients don't get any symptoms due to the issue at the early stages or in the mid stages of the disease. After that only, at the end stages only, they will get the symptoms. That is too late.
So why does that happen, Doctor? What is the reason for the symptoms not presenting early? What is the reason?
Okay.
Some sort of discomfort, pain, vision being affected, maybe can't handle light.
Okay, it's a good question. Usually, we divide glaucoma into various ways, but whenever we talk as glaucoma, we usually talk about primary glaucomas. So, what happens is, so I'll make it simple. So, if you want to see a person's face, then you would fix your eyes onto that person's face, and you would see the face very clearly. You can see the eyes, nose, lips and everything very clearly. But around the face, you don't see things clearly. So the fixation point, the face is actually the central vision. Surrounding area is the peripheral vision. So in the periphery, you don't see things clearly. If you can try it at your home. You just look at one of your relative or mother or father's face and see whether you can see the things around very clearly. You are not going to see that. Wherever you fix, you will see that clearly, but other things you are not going to. So what happens in glaucoma is, glaucoma actually affects the peripheral vision first. So people, if they go to an optician or wherever they get glasses, they will let them to check the vision. They check the vision with the charts there in the shop. So you may able to read from top to bottom all the letters. But that is only they check for the central vision, only the fixation vision. They don't check for the peripheries. So glaucoma at the early stage and the mid stages, it actually affects the peripheral vision. So patients do think they can read everything clearly, they can see the faces clearly. So the patients think that everything is fine. And glaucoma is a very, very slowly progressing disease. So because it's very slow, patients may actually adapt to the vision what they have over a period of time, and at the end stages only it's going to affect the central vision. Then only they realize that they can't see properly. Until such time, even an optician or whoever checks the glasses are not going to catch the disease in time.
So doctor, is there a set time frame for anybody who is being affected with glaucoma that say from the time they set it within, and like you explained at the outset, one doesn't realize that one is going to be affected, the sight is going to be affected, and then when it actually happens, then it has been quite a period of time. So is there a set time frame, or will it vary from person to person?
The vision may affect Depends on the person. Actually, it may vary from person to person. But what we suggest is everybody, they have to be screened for glaucoma. Everyone, every single person. So for example, if a person comes to our clinic for any reason, we screen them for glaucoma before they go out of our doors. Every single patient, regardless of the age, we screen for glaucoma before we send them, because it is an asymptomatic disease. So the problem comes in if the central vision may be affected. It depends on the person. It may vary. So every single person should be screened for glaucoma.
And when you do that, you are able to detect if the person is affected, and if so, to what extent, or if a person is not affected at all.
Yeah. So what we do basically is when they come to our clinic, we check the vision. Thereafter, we put some drops to the eye to check the nerve behind the eye. So we put some drops, enlarge the pupil, and through which with different lenses we look into the eye to check the nerve behind the eye. Depending on the clinical features, actually we may able to tell there is no glaucoma, or maybe glaucoma, or it's a glaucoma. So if we think that it may be a glaucoma, we will go for other testings also. We may go to check the eye pressure. Eye pressure is one of the very important risk factor. That is one of the very, very, very important risk factor, because there are other risk factors for glaucoma as well. Like age is one of the risk factor. Higher the age, higher the chance of glaucoma. Some refractive errors. If a patient is short-sightedness, they might have higher risk for glaucoma, and some are familial, genetically predisposed, and ethnicity also one of the important risk factor. Likewise, there are various risk factors, but eye pressure is the most important risk factor. Luckily, the eye pressure is high in most of the patients. And why I say eye pressure is the most important risk factor, all the other risk factors you can modify. You can't change your age, you can't change your family, genetics or anything. But if the eye pressure is high, we can bring down the eye pressure. So we check the eye pressure. If the eye pressure is high with other clinical features and other testings, then we label them as glaucoma patients. Sometimes even with the test, we do various scans like optical coherence tomography. We check for the visual fields to see whether there is any problem in the periphery, so the surrounding vision. So we do all these things, and we may, if everything fit together, then we label them as having glaucoma. If there may be some doubts also, even though we do all these things, we may end up in doubtful situation. In that case, we label them as glaucoma suspects, and other set of people we can say there is no glaucoma at all. If there is no glaucoma, then that particular patient can check their eyes every 2 years. But if there is glaucoma, depending on the stage of the disease, after doing all these tests, all these examination and things, we can stage the disease. After staging the disease, we would advise the patient when to see again.
So like you said a while ago, that it can, when it's actually detected, then it can be rather late. But if the screening is done, you're able to detect.
Absolutely. That's why screening is very important. So we do screening, and if we can detect them very early, very, very early, we can catch them. There are sophisticated investigations these days. It's available even in the government sector, because the glaucoma is one of the very, very extremely important disease. So if a patient go to the eye clinic in one of the hospitals, they will check the patients for various things, where they will do the clinical examination, doing the testing. Depending on the testing, actually we can find glaucoma very early. We can catch it very early. If we catch that, we can treat them. But if the patient comes at later stages, we can't do anything much, because whatever the damage happens, we can revert it back. Because it actually affects the nerve. If it is gone, gone forever. We can't do anything. Anywhere in the world, they can't do anything. So what we do is, if we catch them, we stop the progression or maximally limit the progression of the disease, so they may maintain their vision throughout their life.
So how do you do that?
Yeah, there are various options. That also depends on the stage of the disease. We classify it as mild, moderate and severe or end-stage glaucoma. So depending on the situation, actually usually we start eye drops to bring down the intra-eye pressure. We call it intraocular pressure. So there are various drops, but unfortunately they are very expensive these days. Other than that, there are various surgeries, laser surgeries, valve surgeries, but everything depends on the stage. But whatever the stage, at the beginning usually we try eye drops to bring down the eye pressure.
And that helps?
That helps a lot. So if depending on the pressure, we decide sort of a target pressure to which we have to bring down the eye pressure. If we achieve the target pressure, most of the time the glaucoma is not going to progress, or the vision is not going to be affected after that. But only thing is, the patient has to come to the clinic regularly. They have to go through a set of investigation each and every time they visit the clinic. Depending on the clinical findings and the investigations, we decide whether there is a progression of the disease or the progression is halted or not. If the disease is still progressing, if the disease is still worsening, then we decide what to do. We may increase the eye drops, or we may go to other modalities of treatment like surgery or laser surgery or whatever. The most difficult part is the compliance. So whether patient is able to continue the drops throughout their life, because it's one thing, it's very expensive. So most of the people in Sri Lanka, they find it difficult to buy the drops. And the other thing is, they don't feel anything while they're using the drops. So for example, if you get fever, if I give you paracetamol, the fever will settle. But here, though they put the drop, they don't feel anything, so they are not going to see any improvement in the vision or nothing like that. So patient might think this drop is not useful, and they might discontinue the drop, and after few years, 1 or 2 years, they might lose their vision, and they may lose their vision completely. They are not going to see the light even. So the important thing is to convince the patient to continue the drug regularly. That is the most challenging thing in glaucoma. Only thing when they use the medication, only thing they are going to see is the side effects. So they might think, a lot of side effects. Eye is red, and the around the eye it's going to be maybe black. The skin may be discolored. So they may think this medication is not useful. I don't see any improvement. So they might discontinue.
I think this is a dilemma that you, as well as all your colleagues across the field, whatever discipline, face in as far as compliance is concerned. Because many patients, even other consultants have sat with me on this program over the years, have had this concern, where patients after some time think, I'm all right, I don't need to take drug. Or they, without seeing the doctor again to check whether the same dosage, the same drug has to be continued, they self-medicate. And so all this then sets in motion a lot of negative, I would say it impacts negatively on their health, and they come back, it has a lot of damage has set in. So I can quite appreciate how you feel about this. So communication is vital, and however much you tell, it's up to them, as you say. But I'm sure you do impress upon them the need to follow medical advice. That's
correct, because communication is very, very important when we consider treating a patient for glaucoma. Otherwise, definitely they are going to discontinue the medication. Other important thing in glaucoma is screening for the family members. if we do see a patient with with glaucoma, then we have to screen the family members because it may be familial also. So that is another important thing. So if we catch a patient very early, then we can screen others also. But in that case also, it's very difficult for us to bring down all the family members to screen for glaucoma, because most of the time, so easily I'll tell you. So if your car has some problem, if you go to the garage, and if the person in garage says this is the problem you have to do, then you would do. But when we tell something to the patient, yeah, you have this sort of a disease, then patient may believe us, may not. It depends on the patient actually. However, so it's our duty to explain what you have to do, but the patient should decide what they have to actually do for that. So we can give the options, we will explain them in detail, but still patient may not going to continue the medication or not going to follow the clinics. That is very common in as far as glaucoma is concerned.
So doctor, when you start on your treatment and spoke of side effects, could you just explain a little more about that for the information of our listeners?
Okay, side effects, in a sense, if we start the medication, they may get sort of a burning sensation in the eyes. There may be increased tearing soon after they instill the medication into the eye, but it may last for about 2 to 3 minutes usually. Other problems, they may get dark circles around the eyes. That is a temporary issue. If they don't like, if they discontinue the medication, it will disappear. And their lashes may grow longer, but some females may like that, but males not going to. Their lashes are going to be longer with a certain medication. And allergies may be there, allergic reactions may be there, so their eyes are going to be red. Even without allergy, their eyes are going to be red with some medication, not all medications. And some people do feel sleepy, drowsy even with a drop of medication. And some other medications are there which may lead to asthma, wheeze, and also some heart problems. But before we start any medication, we thoroughly examine the patient, thoroughly go into the history, and we try to find whether there is any heart issue or any breathing problems or anything before we start any medication. But that might happen even without any previous history. In that case, they just want to discontinue that medication and they have to switch to the other one. That doesn't mean they need to stop the medication completely. If they stop, they are going to lose their vision.
So it's important to follow medical advice to the letter.
Absolutely.
So now, doctor, you spoke of the stages of mild, moderate, severe, and the end stage.
Yeah.
So can you explain these stages, mild to moderate to severe to end stage?
Yeah, it's actually a clinical classification. Mild to moderate disease, patients are not going to see any visual symptoms. They don't have any symptoms. In severe and end-stage glaucoma, their vision is going to be affected. So they may have blurred vision or reduced vision. They may unable to read things. So why we are worried about glaucoma is, I already told you that it's going to affect the peripheral vision first, surrounding vision first. Why we need surrounding vision is, for example, if you walk on the road near a playground, if someone hit a ball, and actually the ball first appear in the surrounding vision, then only you may able to quickly turn your head or maybe able to bring your hand to block that ball. If you don't have the peripheral or surrounding vision, the ball will straight appear in front of your face. That time you don't have the reflex time for you to protect your face from the ball. So peripheral vision or the surrounding vision is very, very important for you to protect yourself from approaching objects. And it is very important for the driving as well. So In the severe stage or end stage glaucoma, they can't drive because the vehicle will suddenly appear in front of your vehicle and you don't see any vehicle approaching, only you are going to see the central area of your vision, and it is not possible. So in the end stage or severe stage glaucoma, not only the surrounding vision, they are unable to read, they are unable to see the television, phone, because the central vision also going to go. At the early stage, mild to moderate, it's going to affect only the surrounding vision.
So what's the remedy?
So if early and moderate stages, actually we can treat them. In the end stage glaucoma, again we are going to treat them. At the same time, depending on their vision, we may need to go for some rehabilitation to the patients as well. There are low vision clinics in the hospitals, so depending on their amount of vision, they will rehabilitate what to do. They may modify their house environment for them to see things clearly. For example, increase the contrast. If there is a staircase in the home, then they may ask them to step by step. Alternatively, they may need to put one step white color tile, the other one black, white, black, so the contrast may be very good, so they may see better. So likewise, they have to modify the environment. It depends on the vision. So there are rehabilitation centers in hospitals.
But obviously you can't have it in your home, but the hospital, yes.
Yes, yeah.
Doctor, so what sort of role does a surgery play in helping a patient to overcome glaucoma?
Okay, so glaucoma, so if the intraocular pressure is high and if we are unable to reduce the pressure with the medication, then we may think of going for surgeries. Actually, we may go for surgery if we are unable to bring down the pressure with medication, or else if the patient has some side effects. For example, if we give a medication and if the patient gets severe redness, allergic reaction in the eye, or if with other medication they may get, as I told you, breathing problems and heart issues, and if we come across that sort of a situation, then we may think of going for surgeries. And in other set of patients, we may need to bring down the pressure a lot. Then with medication we are unable to do that in certain situations. In that case also we can go for surgeries. Surgeries, it's not straightforward. The problem with the cataract surgery is very straightforward. We do that, immediately the vision will improve, patient is happy, the surgeon is also happy. But glaucoma surgeries are not straightforward. We may go and do the surgeries. Surgery may be absolutely well, no problem at all. But post-operatively, after surgery also, the patient must be carefully followed up, because surgery may fail after some time. So in that case we may need to go for some surgeries again. We might give some injections, we may do certain small things to bring down the intraocular pressure. Even with all these approaches or surgeries, we may, since a small set of patients, we may unable to bring down the pressure to where we actually would like to. So that patients actually, they are very unlucky, but we do our best to bring down their pressure. And there are other surgeries as well, valve surgeries, but it's again very expensive. And there are a few other surgeries which is the devices are not available in Sri Lanka, so we are unable to do that. Valve surgeries, valves are there, but the valves are extremely expensive for the patient to buy.
So all told, it is not a rosy situation. So going on from there, Doctor, I just like to ask you one more question before we wind up. Would it finally lead to blindness?
if we don't treat the patient, if they have glaucoma and if they don't get their medication or if they are not treated, definitely it will blind the eyes. Even they are not going to see the light at all. It will totally blind the eye.
What's your take-home message to protect one's eyes?
So the important thing is they have to be screened. All the people in Sri Lanka should be screened for glaucoma. Without screening, they can't identify whether they have glaucoma or not. Most of the time, glaucoma is not going to give any symptoms. That is the most important thing. So, they have to be screened. So, approach an eye surgeon to check their eyes. Then, once you check your eyes, then they will tell you when they have to check it again.
Thank you, Doctor. And on that note of advice, we end this interesting discussion on glaucoma. We place on record our grateful thanks to Dr. Sivayoganathan Premananda, consultant eye surgeon at the University Hospital of the Kotalavala Defence University. Thank you so much, Doctor, for being with us on the program.
Thank you so much.
And giving us a valuable insight into this very, very, what should I say, an ailment in the eye that certainly needs to be attended to because vision is so important.
Thank you so much for the opportunity.
Thank you, Doctor, again. And thank you also to Prabha Veerasurya for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday, same time on Views on Health.